bladder cancer is the fifth most common cancer in Canada, but it's also the most costly to treat.
This is a standard pregnancy test. All it takes is to urinate on the stick, and within minutes, it'll tell you if you're pregnant or not. But what if you could do the same to find out if you have bladder cancer? That's what Quebec researchers have developed, and it could be coming to Quebec doctors' offices very soon.
It's a test based on the detection of proteins, and that can be done just like a pregnancy test, or we're very familiar nowadays with the COVID rapid test as well. It's the same concept. It's essentially putting the sample onto a small plate, and it will move up, and then we'll show some bands, and whether the bands are present or not, that will tell us if the test is positive or not.
Bladder cancer is more common in men than in women. Approximately 12,000 people are diagnosed each year in Canada, with a reoccurrence rate of 60 to 70%. Experts say results for cystoscopies are not 100% accurate. The screening has a 72% accuracy rate for bladder cancer and is also quite expensive, costing around $600 per test.
It's a very invasive test. It also involves a urologist and an operation room, so it's also very costly. And it's because of the delays in the health system right now.
Boisvert predicts the new test would cost just a fraction of that cost, around $35. So essentially would not only be cheaper, but also easier to perform, more accurate and less invasive.
It's very hard right now for cytoscopy to be applied for the population in general at, for example, a certain age to do a large population screening. So essentially the patients that will be seen will be the patient that have symptoms. Most of the time it's blood in the urine. Whereas with the development of a test that's based on urine biomarker, I think one of the advantages of that would be that we can test the population in general, and so catch the cancer earlier, making it easier to treat as well.
The test is so promising, the World Health Organization offering to collaborate with the Sherbrooke University Institute for Cancer Research in the hope of developing one that could be used by all populations. Being able to develop and apply a test that's cheap and readily available would be a big plus for countries, poorer countries. So I think that's part of the mandate of the WHO to try to make available cancer treatment to the whole world. In Montreal, Brittany Henriques, City News.